This is an agentic AI company called Assort Health. They raised $120 million, Series C, valuation $1.2 billion from, again, Menlo Ventures, which is an investor in Anthropic. I found this quote interesting. This is from a partner at Menlo. After investing in Anthropic, our thesis was simple: find the best application layer companies in every category. The value of Assort's platform compounds with every patient interaction. Each one surfaces a new edge case and a new way to improve care, and the platform gets better for the next patient automatically. So, Neil, what can you share about what's going on in gastroenterology as far as agentic AI is concerned? I can do the same. This is the game that I'm playing right now.
Yeah, I mean, Praveen, we've talked about this in other contexts as well. I mean, I think this is the holy grail right now. And I mean, there are multiple pain points that I believe in GI and in healthcare in general that could be solved by an agentic solution. Okay. Most of us are afraid to make them patient facing right away, but I think that's going to be the future frontier. I think the frontier right now, and there's multiple vendors that can offer this right now, are more back office, prior authorization, scheduling, agentic solutions. The next step will be patient facing.
What's going to eventually happen?
I think eventually one of two things will happen. One, the EMR will be the gatekeeper as to which AI solution will win, or you'll have a fully, what they like to call, I think they start using AI native operating system that allows any vendor to plug and play. I think which one wins, it depends on where you practice and who you partner with.
Matt, your take on what you see.
Yeah. I don't know. It feels like there's these battlegrounds. I feel like it's going to get kind of ugly. The prior auth war between insurance and physicians, it's kind of going to be like whose AI is stronger wins out, which I don't know, feels kind of dystopian. And then I think same thing on the patient side. You're going to have healthcare developing agents to interface with patients and do intake and questionnaires and all sorts of things. And then thinking about it from the patient side, like, do I really want to be talking to the bot for Kaiser? Not really. So can I just get my own agent to do that on my behalf? It's like, is anyone even doing anything on their own anymore? It feels a little bit weird, and we're accelerating to it pretty quickly.
Yeah, Praveen, it makes me think of that earlier episode where we had, what was that, AI agent community where they were talking to each other. I mean, that's
Right.
really
Yeah,
what Matt,
Claude.
that's what
Yeah,
Matt,
Claude,
that's what
Claude
Matt,
bot. Yeah.
exactly, that's what Matt's describing. Eventually you just have AI talk to AI. I'm not sure what humans will be doing at that time. I don't
Yeah.
know. That's interesting.
Coming up on the Scope Forward show, Matt's AI talks to Praveen's
Right.
AI.
Yeah,
And the audience is a bunch of bots listening to
yeah.
us.
I mean, we basically just had ChatGPT run the interview for us anyway right now, so it's not that different.
My take and what I know of what's happening is if you look at the GI workflow and break it down into front office, clinical operations or care coordination, back office, all the other stuff. Like, so each of those pieces, there are AI solutions already existing or coming up. For example, front office inbound AI call center receiving calls from patients. There are automations to do or AI to do prior auths or benefits and verification or generating appeal letters. Or there is stuff doing outbound recalls, following up on colonoscopy. All this stuff is happening today. What's going to happen next is once this set of AI agents find their way out there, we got to start stitching the workflow up. That is an orchestration or an integration of all of these AI agents where the handoffs happen. And then the entire process, what goes on manually today, will be automated. Like, so I see that happening definitely, like, very quickly. If we lay that foundation, then that opens doors for doing clinical AI stuff, like more systematically, and that would be What if GI care were to be run by bots, or to what extent it can be done, like in terms of triaging, in terms of the first interactions with the patients, and if you go in that direction. So, Neil, what are your comments on that? Like, where will all this go? And when it gets into AI, like really assisting the gastroenterologist, taking over large portions of what you do, what would that look like?
I think what you need is like you said, orchestration, right? Like an operating system, right? You want an operating system that basically syncs up all the different AI solutions and one seamless one. Not only do we want that for us as the, I guess, consumer or physician or endoscopist, we want that for our patient too, right? So if you're a patient right now, you don't want, I mean, I already don't like it when I get 15 text reminders for an appointment. Now imagine you have 5 different AI solutions, all give you different messages. You want it all come from one place, ideally some place that is synced up with your doctor's office, right? That's where we are right now. And I think an operating system that can do that will be successful. In terms of augmentation versus assistance versus replacement, we have the spectrum, right? So right now we are okay with augmentation and assistance. When will we be okay with replacement? And I think it's all, technology is only going to get better. Everything just gets better, right? That's how life evolves. So I don't know the answer there, but I think in terms of what we need right now, we, the patient, we, the clinician, want a single operating system that does all the AI connections for us. And there are vendors now starting to create that concept.
Matt, any comments?
No, I mean, it is just interesting how much funding and attention this is driven, even just to these administrative layers of healthcare. It's like the activity of healthcare drives so much value in the economy that it is the obvious place that everyone is attacking. Because even if you solve a small problem, there's a huge market for it.